Welcome all of you. I am Muhammad Mustafa. We will talking about the use of stem cells in the treatment of autoimmune diseases, supervised by Dr. Omar Kibbi. The objectives: introduction about stem cells therapy, how stem cells can treat autoimmune diseases, the autoimmune diseases that can be treated by stem cells, obstacles of stem cells therapy, and conclusion. So, stem cells. As we already know, that stem cells are cells from which all other cells with specialized function are generated. Under the right condition, the stem cells divided to form more cells called daughter cells. These daughter cells either become new stem cells, self-renewal, or become specialized cells, differentiation, with a more specific function such as nerve cells, liver cells, cardiac cells, or blood cells. No other cells in the body has the natural ability to generate new cell types. Why is there such an interest in stem cells? Generate healthy cells to replace diseased cells, regenerative medicine. Stem cells can be guided into becoming specific cells that can be used to regenerate and repair diseased or damaged tissue in people. Test new drugs for safety and effectiveness. Before using investigational drugs in people, researchers can use some types of stem cells to test the drugs for safety and quality. Where do stem cells come from? Researchers have discovered several sources of stem cells. Embryonic stem cells. These stem cells come from embryos that are 3 to 5 days old. At this stage, an embryo is called blastocyst and has about 150 cells. These are pluripotent stem cells, meaning they can divide to more stem cells or can become any type of cells in the body. This versatility allows embryonic stem cells to be used to regenerate or repair diseased tissue and organ. Adult stem cells. These stem cells are found in small numbers in most adult tissue, such as bone marrow or fat. Compared with embryonic stem cells, adult stem cells have more limited ability to give rise to various cells of the body. Until recently, researchers thought adult stem cells could create only similar types of induced pluripotent stem cells. Scientists have successfully transformed regular adult cells into stem cells using genetic reprogramming. By altering the genes in the adult cells, researchers can reprogram the cells to act similarly to embryonic stem cells. Perinatal stem cells. Researchers have discovered stem cells in amniotic fluid as well as umbilical cord blood. These stem cells also have the ability to change into specialized cells.
Everyone, I am Furat Hadir, a third-year medical student. Now I'll talk about the general concept of stem cell therapy. Stem cell therapy is a form of regenerative medicine designed to repair damaged cells within the body by reducing inflammation and modulating the immune system. This property makes stem cell therapy a valuable treatment option for a variety of medical conditions, as we will see in the next slides. Here are the advantages of stem cell therapy. First, safe autologous therapy. They are harvested from patient's body and redeployed where they are needed. No need for surgical interventions. They bring versatility. They can be used for a wide number of applications with promising results. Faster treatment and recovery. Finally, less dependence on medication. This slide shows the procedures of the general procedures of stem cell therapy. We can see that collection are done from the patient's blood, not the bone marrow, for easier access. We use mobilization via growth factors and chemotherapy, then the processing and the freezing. Then storage in a liquid nitrogen tank until infusion day. Then the chemotherapy radiation is given to the patient. Infusion are infused in the patient. We determine the infusion area via MRI, X-ray, and ultrasound techniques. Support and follow-up. Support with the blood products and antibiotics for about 2 weeks. Further follow-up for about 2 to 3 months with regular blood tests and medications.
Welcome all of you. I'm Istabrak Ammar. I'll talk about how stem cell can treat autoimmune diseases. As we all know, autoimmune diseases is a condition in which the immune system mistakenly attacks the body, and currently autoimmune conditions are treated with immune suppressive agents such as steroid, methotrexate, cyclosporine, and more recently infliximab. Despite inducing temporary improvement, this approach poses the possibility of long-term adverse effects, as well as needs for lifelong treatment. So, stem cell transplantation has the potential to become an important therapeutic approach to the treatment of various autoimmune diseases, and this can be achieved by, first, destruction the self-reacting immune cell and produce a new functional immune system. In Brazil and throughout the world, they found various results that support the fact that autoreactive immune cell can be destroyed by stem cell transplantation. Second, re-establishment of bone marrow. Stem cell therapy is emerging as one of the most promising tools for promoting tissue repair and protecting from damage caused by immune attack. Third, suppression of inflammation. Fourth, inhibits the formation of antibody to own tissue. Fifth, slow down fibrotic degenerations of the affected organ. This slide shows the effects of a stem cell on immune tolerance. Stem cell leads to increased regulatory T cell, which have a role in suppressing other cells, and decrease the inflammatory cell, T and B cell. Stem cell is also lead to increase the production of these biomolecules, interleukin-10, transforming growth factor beta, prostaglandin E2, and nitric oxide, which have immunosuppression properties. Now, my colleague will continue with you.
Welcome all of you. I am Hajur Manhal. I talk about the autoimmune disease that can treat by stem cell. The first one, diabetes mellitus type 1. The second one, multiple sclerosis. The third one, systemic lupus erythematosus. The fourth one, rheumatoid arthritis. We start with diabetes mellitus type 1. Diabetes mellitus type 1 is autoimmune disease caused by destruction of island of Langerhans containing beta cell. In this figure, we show in type 1 diabetes mellitus there is very little or no insulin produced by beta cell to stimulate the receptors on the cell surface. So the glucose remain in the bloodstream and can't enter the cell, while in type 2 diabetes mellitus insulin is available, but there is defect in the receptors and insulin can't bind to receptors. So the glucose remain in the bloodstream. How can we use stem cell in treat diabetes mellitus type 1? A human stem cell can be used to create insulin producing pancreatic island. This figure is short summary about extraction of a stem cell. First step, extraction of a stem cell from the body. Second step, we enriching them in lab by special stain. Third step, programming and inducing pluripotency. The fourth step, we differentiation stem cell to beta cell. The last step, stem cell transplantation. One of the research of stem cell in treat diabetes type 1. Researchers have had success with using stem cell to treat type 1 diabetes in mice. The researchers were unable to inject stem cell directly into pancreatic island because of fragility of pancreas. Additionally, the pancreas release highly toxic enzyme when manipulated. The team created the H-cell homing molecule to guide the stem cell to the inflamed pancreatic island. The injections were found to create a sustained reversal of diabetes and take away the need to administer insulin for up to 2.5 years. In this slide, we show a source of stem cell used in treat diabetes mellitus. The first one embryonic stem cell, the second one mesenchymal stem cell, the third one pluripotent stem cell, the fourth one induced pluripotent stem cell. These cells are treated by special stains such as laminin, nicotinamide, insulin to differentiation to beta cell. Now my friend will continue with you.
Hello everyone, this is Shahad Marwan, a third year medical student. Now we will talk about the role of mesenchymal stem cells in the treatment of multiple sclerosis. Let's take an overview about the disease. Multiple sclerosis is a potentially disabling disease of the brain and spinal cord. In multiple sclerosis, the immune system attacks the protective sheath myelin that covers nerve fibers and causes communication problems between your brain and the rest of your body. Eventually, the disease can cause permanent damage or deterioration of the nerves. This will result in many problems. We will have a problem in vision, mouth and speech, brain, spinal cord, urinary system, and many other affected areas. Now, how can we use the umbilical-derived mesenchymal stem cells in multiple sclerosis treatment? Umbilical-derived mesenchymal stem cells are immunosuppressive. We transplanted mesenchymal stem cells in a patient with refractory progressive multiple sclerosis, and the disease course was stabilized after the transplantation. We postulate that mesenchymal stem cells have a potent immunosuppressive effect in vivo. For 2017, researchers gathered and analyzed 15 studies published between 1995 and 2016 involving 764 people with various forms of multiple sclerosis who underwent transplantations using stem cells like those in cord blood, giving us our most expansive look at how these stem cells can be used to treat the condition. The analysis showed a significant benefit up to 2 years post-transplantation, with the progress of the disease stopping in 83% of participants. This picture shows the average scale scores of symptoms of multiple sclerosis patients who underwent a transplantation with umbilical cord-derived mesenchymal stem cells in the trials above. Symptoms improvement were most notable 1 month after treatment. Improvement were seen in energy, pain, social functioning, physical functioning, and general health, and many other symptoms related to multiple sclerosis. This shows that the treatment with umbilical cord mesenchymal stem cells intravenous infusions for subjects with multiple sclerosis is safe, and potential therapeutic benefit should be further investigated.
Welcome all of you. My name is Manan, third year medical student. Today I will talk about the treatment of SLE disease by using stem cells. In the beginning, as you already know, systemic lupus erythematosus is a chronic autoimmune disease characterized by the production of unusual antibodies in the blood. The patient may present with various systemic manifestations, include a rash on the cheeks and nose, which is called a butterfly rash. Stem cell treatment for lupus. Mesenchymal cells help in the production of healthy CD4, CD25, and regulatory T cells through enhanced allogenic stem cell therapy. First of all, there will be extraction of mesenchymal cells, assigning function to cells, and then administration of stem cells. As a result, there will be enhanced network of blood vessels due to angiogenic properties of mesenchymal stem cells, a promotion of hormonal balance, and regulation of immune system. General treatment overview. Total number of mesenchymal stem cell infusion will depend on patient needs. Types of injection for treating SLE will include intravenous drip, direct injection, or intrathecally. Patients with multiple conditions may require cell delivery by guided scopes. Rehabilitation post-treatment. Physical rehabilitation in Bangkok is optional but highly recommended. Total treatment time required estimated around 2 to 3 weeks. Allogenic mesenchymal stem cells transplantation, a pilot clinical study. The figure demonstrates the SLE disease active index score in 15 patients with refractory SLE before and after mesenchymal stem cells transplantation. The SLE disease active index score decreased in all patients after transplantation. The differences were significant on follow-up at 1, 3, 6, 12, and 24 months compared with the original index before transplantation. And now my colleague will continue with you.
Welcome all. My name is Ala Baha. I'm a third-year medical student at University of Mosul. Today we're going to talk about the treatment of rheumatoid arthritis by the stem cells. As we all know, rheumatoid arthritis is an autoimmune chronic systemic inflammatory disease whose hallmark feature is a persistent symmetric polyarthritis synovitis that affect the hands and the feet. Actually, any joint lined by a synovial membrane may be involved. It could also include extra-articular involvement of organs such as skin, heart, lung, and eyes. RA is theorized to develop when a genetically susceptible individual experiences an external trigger, such as a smoking, infection, or trauma that trigger an autoimmune reaction. Both humoral and cell-mediated immune response appear to participate in the immunopathogenesis of the rheumatoid arthritis. Rheumatoid arthritis is characterized by the immune cell infiltration in the joint, like rheumatoid factors and antibodies against post-triangulation or modified protein like ACPA and anti-CAR-B antibodies. These autoantibodies may form immune complex in the joint, leading to the attraction of the immune cells, which lead to self-attack for the synovial membrane. Additional thing that the cytokines such as TNF-alpha and interleukin-1 and interleukin-17 stimulate inflammation and degradation of the bone and the cartilage. In this slide, as you see in this diagram, it shows the mesenchymal stem cells' immunomodulatory effect on the immune system. When the immune system is overactive, which is our case, mesenchymal stem cells secrete anti-inflammatory cytokines and mediators such as interleukin-4 and interleukin-16 to avoid cells over-attack. On the other hand, when the immune system is underactive, mesenchymal stem cells secrete pro-inflammatory cytokines and mediators such as TNF-alpha and interleukin-1. Regarding the preclinical study for mesenchymal stem cells in the treatment of the rheumatoid arthritis, we should mention the sources of the mesenchymal stem cells, which is adult bone marrow, adipose tissue, umbilical cord, and umbilical cord blood. Mesenchymal stem cell-based therapy can decrease the degree of arthritis inflammation down to 30% in the majority of the experimental models of RI used. Mostly the clinical study for the mesenchymal stem cells. First of all, a promising result in the term of safety and efficiency has been observed. Second, no adverse effect and only a moderate response to the mesenchymal stem cell therapy have been observed in all the RA clinical trial conduct so far. Third, efficiency observed during 2 years of follow-up, which is to point it out, it is a long-term effect of the mesenchymal stem cells in the RA patient, in agreement with what has been observed in other immune-mediated disease. I finished my part and my colleague will continue. Thank you.
Hi everyone, I am Mohammed Baqir and I will continue this seminar talking about obstacle of stem cell therapy. Scientists are facing some significant problems and challenges along with ethical dilemmas around this therapeutic technique. First, it is hard to isolate, process and differentiate stem cells into a desired cell type. Second, there are some difficulties in growing stem cells and maintaining them in a suitable media. Third, the patient body has to accept implanted stem cells as a native cells, which relies on effective integration. Fourth, implanted stem cells must also first be screened for purity and for the presence of cancer cells. Fifth, immunological reaction. Recipients of stem cells usually need immunosuppressive drug, which leave them vulnerable to infection. Sixth, the brain is the most challenging of organs that can utilize stem cell therapy due to the complexity of neurons and the multiple interaction in the brain. Seventh, many degenerative neurological disorders such as Alzheimer's disease involve more than one cell type, making them difficult target for stem cell-based therapy. As we see here in this figure, we take somatic cells from autoimmune disease patient or healthy individual, and by gene editing, we will get an induced pluripotent stem cell. Then we differentiate it to brain cell type, neurons, oligodendrocyte, astrocyte, microglia, and neuronal progenitor cells. Then, by 3D co-culture, we will simulate neuronal cells in interaction in vivo. And then, by autoimmune disease modeling, we discover drugs that may help. And lastly, we applied the therapy to the patient. Now, my colleague Sabhan will continue.
Assalamu alaikum. My name is Sabhan Faris and I am going to introduce the conclusion. After several decades of experiments, stem cell therapy is becoming a magnificent game changer for medicine. With each experiment, the capabilities of stem cells are growing, although there are still many obstacles to overcome. Regardless, the influence of stem cells in regenerative medicine and transplantology is immense. Currently, untreatable neurodegenerative diseases have the possibility of becoming treatable with stem cell therapy. Induced pluripotency enables the use of a patient's own cells. Tissue banks are becoming increasingly popular as they gather cells that are the source of regenerative medicine in a struggle against the present and the future diseases. With stem cell therapy and all its regenerative benefits, we are better to prolong human life than at any time in history. Here an animated overview to stem cell therapy.
What is stem cell therapy? Stem cell therapy is an injection treatment designed to heal injuries and reduce pain. It is used for arthritis and injuries to ligaments, tendons, muscles, cartilage, and bone. First, let's look at the difference between human embryonic stem cells and adult stem cells. The embryonic stem cells are pluripotent, meaning that they can become of any of the more than 200 known differentiated cell types of the human body. On the other hand, adult stem cells are multipotent, meaning that they can develop into more than one cell type, but are more limited and controlled, and thus safer than pluripotent cells. We perform the adult stem cell treatment. What is the role of these stem cells? To understand this better, let's look at this, and your body needs stem cells. Now, let's dive deeper and see what happens to your joints. In a normal healthy joint, you have plenty of stem cells. These cells are not only capable of doing maintenance and repairs, they also know when and where these repairs are needed. The stem cells work as a contractor that, in addition to giving instruction for repairs and maintenance, can transform into specialized cells to do whatever is needed to fix any problem. When you have enough of these stem cells, there's a balance between damage and repair, and you have no pain and no injuries. Think about when you were 18 years old. You were able to run, jump, and do the same the next day without pain. The only problem is that with time, the number of these stem cells goes down, or sometimes the severity of the injury or damage is more than the ability of your body to repair it. This leads to an imbalance and ultimately leads to arthritis, injuries, and pain. In essence, as you age, you have a lower number of contractors and workers available to do the job, or sometimes the amount of damage is too much for the available stem cells. But fortunately, there are areas of your body that keep a good number of stem cells. These areas include the bone marrow of the hips and the fat in your abdomen and buttocks. And this is the key to stem cell therapy. The doctor will take stem cells from one or both of these areas and transfer them to the area of injury or arthritis. This will provide the stem cells needed for repair. In essence, the treatment will supply the manpower needed to do the job. Once there, these cells secrete growth factors that will organize and coordinate other cells to do the repairs. This leads to healing. This is like the contractor giving instructions to get the job done. This treatment can be used for pain with injuries coming from ligaments, tendons, muscles, bones, cartilage, and meniscus. When is it useful? If you have an injury or an arthritic condition that did not improve with therapy, medication, other injections, or surgery, or if you were told you need surgery, then stem cells is a great option for you. Thanks for watching.
Here are the references. Thank you.